Hello everyone, my name of course is Artimage.
And I'm Pup.
And welcome to day 1 of VEDA, vlog every day of April, which seems to be the only time that I post things on my channel. Everyone of course knows Shadow, who has decided he wants to feature and not just cameo for a change.
He is the mascot.
So a couple of years ago for VEDA, I did a video covering the topic of the benefits of a diagnosis when it comes to a mental health issue.
Yeah.
As much as people might be afraid of having that label attached to them. Pup has recently gone through this experience.
Yeah.
So Pup, what was your recent diagnosis with?
My recent diagnosis was with attention deficit hyperactivity disorder, ADHD.
And this is something you believed you had for a while,
Yeah.
correct?
Ironically, because of my disorder, I tend to obsess over things and focus on things, and I got myself really focused on trying to figure out what was wrong with me. A lot of this came out from having friends who are neurodivergent and who have ADHD and have autism, and a large part of me was like, that seems familiar. I looked up like the DSM-4, I looked up, various places like ADHD Alien is a really good resource if you're questioning things. Other stories from people who have ADHD. And a lot of the things they described, I'm like, oh, yeah, me. It took a lot. It was a very difficult experience, but I eventually got to a mental health professional who essentially said, yeah, no question about it. You check all the boxes. 100% you have ADHD, which was really validating. And now I have the ability to get actually the treatment that I need. But it's something, and at least it was really validating as well to hear that I'm not making it up. I am right. Everything that I said was true. Everything that I thought I was experiencing, I am actually experiencing. Things are more difficult for me, and things are harder, and it's so easy to fall into these traps of thinking that you somehow aren't trying when you have ADHD. To have a professional to actually tell me that, you're right, and it is really hard for you, and it's impressive that you've done it so far. It felt really nice. It was really validating to finally be told by someone that ironically, it's like there's nothing wrong with me as a person. It's not like I'm a bad person. It's not like I'm lazy. It's that I am experiencing something that is very difficult, and I have this disorder that needs treatment.
Now, what was the hardest hurdle that you experienced in the process of this?
Without question, actually getting to the medical care that I needed. The hardest thing is to have doctors who don't listen to you, or people who aren't supportive in your life. I have known that there was something up with me for years and years and years, my entire adult life pretty much. And even when I was a child, I had these same sort of issues with things like executive dysfunction and hyper-focus and not being able to do things if I wasn't interested in them. And I would tell my my mother specifically, I'm having trouble with it. I told my mother recently, I will never forget this. I've told her that I have always had trouble with executive dysfunction. And she said, no, I don't think so. You've always been lazy, yeah. And it's like, okay, well, that's fine. It's stressful to deal with that. And then once you finally manage to get a medical professional, it's like waiting periods for non-emergency mental health. I asked for a mental health referral from my family doctor once I managed to actually get through to my family doctor. And she just didn't put it through. She wouldn't put in a referral for me because it was the waiting periods are very long. Shouldn't that mean you put it in immediately then instead of just waiting? But no. Trigger warning for this upcoming bit. If you're triggered by thoughts of suicide or mental health breakdowns and crisis, skip to this point in the video. She just didn't put it in. And eventually what happened was, the thing that really got me to a point where I could get my diagnosis was actually, a few months ago now, I got into a crisis state where I realized I had a plan to kill myself. And I called a crisis hotline that's local to me, and sort of told them, hey, experiencing. I'm not sure if I'm going to be safe. So they were able to sort of fast track a referral to me to the community psychiatry clinic in St. Joseph's Hospital in Hamilton, which was exactly what I needed, just to get someone to diagnose me and to help me get on the right path to managing this issue. But the thing, and I've talked about this before on a clip on Twitch, the thing that sort of gets to me is that it should not have taken that long. I should not have had to get to that point in order to get the help that I need and in order to get the diagnosis that I need.
Now, unfortunately, this story is not uncommon with those that I've heard from people suffering mental health issues. A former friend of mine had to have a complete suicidal breakdown before even getting a diagnosis. They once tried to put themselves into a 72-hour observational surrender and were turned away being told the beds were full.
It was suggested to me, just go get a psychologist. My sister has a psychologist. It's a great idea. You should get one. And then you look and it's like $150 for an hour. And like, while I'm sure they're worth it, on my salary at like a part-time retail job, because that's all I could find and that's all I could keep with my mental health, like, I cannot afford that. No one can afford that. This stuff should be covered by our socialized medicine. And Dogga, you're very in the way. It's okay. Good dog.
He's trying to do his job.
He's being...
So, Pup, where are the next steps for you in your care for your new diagnosed condition?
Well, the next steps would be, I fortunately got the psychiatrist that I met with to give me a list of medications and suggested treatments. ADHD is kind of, it's not a one-size-fits-all diagnosis, so it's not like when you have an infection, you prescribe penicillin. In order to treat ADHD, you need to have the support of a family doctor, usually someone who's working very closely with you to monitor medication levels, check in regularly, see how you're doing, and see if maybe things need to be adjusted, like dosages or actual types of medications. Unfortunately, I don't have a family doctor who will work with me, so that sort of put a really big hindrance, and ironically, having ADHD makes it much harder for me to actually initiate the process of getting a new doctor. When it comes to next steps, unfortunately, I'm sort of stagnating. I'm hoping to get a new doctor soon and get on the right medications, but also I recognize that that's probably going to take some time. So I don't expect to be, I'm never going to be cured of ADHD as well. Like, I think that's an important point. I can learn how to manage it, but a lot of these issues do not go away with treatment. It's just, this is how I experience the world. Much like other types of neurodivergence, like autism, it's a combination of being a treatable disorder as well as just a different way of being a person. And there are parts of my ADHD that I like and that I don't want to change. Like, I like that I can focus on something and become an expert in it. One of my hyperfixations was fish for a really long time, and I'm now really good at caring for fish and at managing aquariums. I find joy in that. I mean, I don't like that I don't get up and go to the bathroom, and I don't like that I don't get up and eat, but I do like that I can get so engrossed and immersed in something. So it's sort of a balancing act, and I'm not an expert on ADHD. I just have it. And that's another important, point I think we need to mention in this video here. I am an individual who has ADHD. My story is not yours. Even if you have ADHD, you could experience it completely differently to me. What we're trying to talk about here is the diagnosis process, how validating and how good it can feel to have a diagnosis and to know how to work within it, rather than thinking that you're just broken or messed up or not trying hard enough. What we're not trying to do is say, this is how this looks, because it could be anything. It could be my disorder could have also just been, it could have been a physical ailment. It could have been chronic pain. It could have been any number of things.
And you may have to fight with your healthcare providers to get some of these details. Go back to my VEDA Year 1 to see the video with Angie Nash discussing self-advocacy as a patient.
Yeah. Angie Nash is she's, oh my god. She is tougher than I have ever known anybody to be. Self-advocacy is hard, especially if you're dealing with anxiety, if you are one of the types of people, especially if your disorder makes it hard for you to like make phone calls or change tasks and do something that's really difficult. Even for someone neurotypical, or healthy, it's hard to do these things. And disabled people have it so much harder. Just don't give up. It's hard as nails, but it's worth doing to get to a point where you can feel like progress is being made.
So that's going to wrap it up for the first day of VEDA. Make sure you come back every day this month for more content, some of which I have planned out. Most of it I do not.
Yeah.
So we'll see how that goes. So until tomorrow, take care of yourselves and each other. You don't have hands.
I do not. I forgot! ADHD!
So until tomorrow, take care of yourselves and each other.
And we'll see you on the next adventure.
Just cover, this is not very bonus.
But it's better. Ow!
Is it any worse than Jazz's see you later?
That would result in the same happiness of having a diagnosis. So there's no... I'm not paying attention to what I'm saying anymore. I'm sorry. ADHD! What can I say?
That's going to bloopers.
Thank you.
So until tomorrow, take care of yourselves and each other.
We'll talk to you later. Was that wrong?
That's Jazz's. So until tomorrow, take care of yourselves and each other.
We'll talk to you soon. Yes?
Yes.
Good.